Welcome to this explainer. Today, we're diving into a topic that, let's be honest, can definitely stir up a bit of anxiety. But at its core, this whole conversation, it's really about empowerment. It's about you taking charge of your health. We're going to break down the realities of fertility in your 30s, sticking strictly to the clinical facts and medical guidelines. You know, your 30s are this incredible decade of massive transformation, personally, professionally, and for a lot of folks, it's the time when family planning really takes center stage. So our goal today is just to give you a clear, structured look at your reproductive health right now so you can make informed decisions completely on your own timeline. Let's get into it. Here's our quick roadmap for today. We'll be covering the biology of your 30s, the health factors influencing fertility, how to navigate potential pregnancy risks, proactive steps you can take, and finally, exactly when to seek medical support. All right, let's jump right into section 1, the biology of your 30s, understanding the timeline. So before we even talk about maximizing fertility, we need to look objectively at how things naturally shift during this specific decade. Basically, there's a distinct biological shift that happens right around mid-decade. Now, if you have ovaries, your early 30s are usually a time when conception is still relatively straightforward for a lot of people, and healthy pregnancies are incredibly common. But there is a noticeable pivot that happens after age 35. From that point on, the medical data clearly shows that the quantity and the quality of your eggs begin to diminish at a slightly faster rate. And yeah, this biological change can increase the risk of things like having trouble conceiving, miscarriage, or chromosomal abnormalities. But, and this is a massive but, these changes absolutely do not mean you can't conceive or have a perfectly healthy pregnancy after 35. It just highlights why understanding your body's specific timeline is absolutely crucial. Now, if you're over 35 and even just starting to look into fertility, you've probably bumped into this incredibly heavy-sounding medical term, advanced maternal age. Or maybe you've heard the older, frankly much more intimidating term, geriatric pregnancy. Let's just strip away the stigma from that right now. It's literally just a clinical marker. It's a label used by healthcare providers simply to indicate that someone trying to conceive is 35 or older. So why does this even matter? Well, hitting this clinical marker just signals to your doctor that they need to keep a slightly closer eye on your reproductive health. It's a flag for proactive care, definitely not a diagnosis of failure. Moving on to section 2, health factors influencing fertility, the variables you can monitor. While age is obviously a big piece of the puzzle, it is far from the only one. Your overall hormonal and physical health plays a massive role behind the scenes. Underlying health conditions are often these sort of invisible variables in the equation. Hormonal balance is absolutely key here. Conditions like PCOS, polycystic ovary syndrome, or thyroid issues can actively interfere with ovulation. And then there's endometriosis. This is a condition where endometrial-like tissue actually grows outside your uterus, and it can create some pretty significant physical and hormonal roadblocks for conception. The main takeaway here? If you're dealing with irregular cycles, severe pain, or you've been diagnosed with any of these conditions, they are critical variables in your fertility equation that definitely require medical management. Now, beyond specific medical conditions, your daily lifestyle choices act as highly controllable variables. We're talking about things like having difficulty maintaining a moderate weight, eating a non-nutritious diet, regular alcohol consumption, smoking, and of course, chronic high stress levels. All of these things directly impact your body's delicate reproductive systems. They can influence everything from hormone production right down to egg quality. But hey, the good news? Because these are lifestyle factors, these are areas where you have immense agency to step in and make positive changes right now. Which brings us to section 3, navigating potential pregnancy risks. Why monitoring matters. We really need to acknowledge the clinical realities here so that you can advocate for the absolute best care. For folks over 35, there is a slightly higher statistical likelihood of certain complications. We're looking at things like gestational diabetes, preeclampsia, and preterm birth. Again, having healthy pregnancies in your 30s is incredibly common, but the statistical risk for these specific issues does tick upward. The antidote to that risk, though? Proactive care. Because doctors know these risks exist, your care team will likely recommend some additional screenings and specific prenatal testing. By staying in super close communication with your doctors, you can catch any early warning signs and ensure the best possible outcome for both you and the baby. Okay, section 4, proactive steps for fertility, taking agency. This is honestly the most empowering part of our explainer today. We're shifting our focus entirely to what you can actively do to prepare your body. Here is your 4-step personal action plan to maximize your fertility. Step 1, schedule a preconception doctor visit. Seriously, don't wait until you're struggling. Go now, just to identify any underlying health concerns and get yourself on the right track. Step 2, focus on a nutritious diet packed with whole foods and start taking the right vitamins. Step 3, keep an active lifestyle and manage your stress. I mean it. Things like regular exercise, mindfulness practices, and just getting enough sleep genuinely boost your overall well-being and fertility. And finally, step 4, avoid environmental toxins, alcohol, and smoking, because those can actively harm your reproductive health. Actually, let's zoom in on that second step for a second, regarding diet and vitamins. Because this is literally foundational. When you're preparing for pregnancy, your body needs specific building blocks to work with. Folic acid, iron, omega-3 fatty acids, and vitamin D, these are absolutely vital for both your reproductive health and those super early stages of prenatal development. Your doctor is almost certainly going to recommend a high-quality prenatal vitamin to make sure you're fully stocked up on all these necessary nutrients well before you ever even see a positive pregnancy test. And finally, Section 5, when to seek medical support, your backup team. Sometimes, even when you follow all the proactive steps, you eat perfectly, you manage your stress flawlessly, you might still need a little bit of help. And that's why we need to destigmatize calling in the experts. I really want you to burn this number into your memory, 6. If you are over 35 years old, 6 months is your clinical benchmark. If you've been actively trying to conceive for 6 months without success, it is time to go consult a fertility specialist. Just for context, if you're under 35, the general guideline is usually a year, but after 35, that timeline accelerates to 6 months. Please do not wait. Getting an evaluation isn't a bad thing. It's simply gathering data about your own body. And hey, if you do end up needing some help, you have some truly incredible science on your side today. Specialists can evaluate your reproductive health and recommend some highly effective interventions. This might mean something as simple as fertility medications to just help induce ovulation. It might mean intrauterine insemination, commonly known as IUI. Or it could be in vitro fertilization, or IVF. Getting medical help is not a failure, not by a long shot. It is simply a proactive step toward your family-building goals. The advances in these specific medical treatments are mind-blowing, and they've helped countless people in their 30s and beyond successfully conceive and carry healthy pregnancies. To wrap up this explainer, I want to leave you with a quick thought. Your 30s are just an incredible, vibrant time of life. And yeah, while fertility naturally declines, being informed is exactly what empowers you to take control of the wheel. So, I have to ask, what proactive step are you going to take for your reproductive health today? Are you going to call and schedule that preconception appointment? Maybe start researching a really great prenatal vitamin? Or honestly, maybe just focus on getting a little more sleep tonight? Whatever it is, you now have the structured knowledge to start making those decisions entirely on your own timeline. Thanks so much for learning with me today.